medical assisting technology program prepares students to work in ambulatory healthcare settings, such as physicians' offices and multi-specialty clinics. Students receive formal training on how to perform administrative, clinical, and laboratory tasks. In an administrative setting, MAs manage the telephones, collect data necessary for billing and insurance, as well as perform inventory of supplies. As a part of their clinical or laboratory duties, MAs obtain vital signs, clean and prepare exam rooms, assist providers with exams and procedures, clean and sterilize instruments, administer medications, and perform CLIA lab testing. The program places high emphasis on the students' soft skills such as communication, organization, time management, and leadership abilities. Following 2 semesters in the classroom, the students finish up the program at a local clinic where they will work with the clinic staff performing tasks learned in the classroom. Competent, reliable, and ethical medical assistants are vital for the smooth functioning of clinics and are therefore in high demand.
I love the hands-on training we get to do every day for so many different skills. Last semester, we learned how to obtain vital signs and perform basic lab tests. And now this semester, we're learning how to use an electronic medical record and how to build an insurance company for the medications we administer. We really do learn the overall function of a clinic, and I'm excited about how many job opportunities there are for medical assistants.
We make sure that the graduates are well prepared to perform entry-level skills required in today's modern healthcare clinic. Graduates understand the role they will play in a team-based approach to healthcare. Once employed, the graduates use the knowledge gained from the program combined with the on-the-job training to grow those skills, with many moving into supervisory roles. Employers are always impressed with the versatile skill set and the computer knowledge the graduates possess.
Throughout my time in this program, I learned many valuable skills that allowed me to not only excel in my workplace, but also in life. I was presented with situations that simulated a real workplace environment, which helped me to develop the confidence that I needed to provide patient care. I loved being able to explore what medical assistants could do in doctors' offices, and after I graduated, I enjoyed not only providing that care, but also educating them on what medical assistants are trained to do.
At Northeast, our goal is for every student to graduate with the skills and knowledge needed for the next step in their career or education. Here are some program highlights for medical assisting technology. For more information on this program, send us an email or visit our website.